To start it off, my name is Crystal Baidan, and I career shadowed a women's health nurse practitioner. My mentor's name is Nicole Bashir, and she holds a bachelor's and a master's in nursing, and she's currently working at my medical group specializing in OBGYN as a nurse practitioner. In 3 words, I would describe her as smart, inspirational, and the best mentor I could possibly ask for. Why women's health? Okay, I chose women's health because of personal experiences. Last summer I met my mentor because my mom tricked me into getting a well women's exam, and so later on it became an aspiration because I learned about my reproductive health and how to keep it well, and I then wanted to become a person in women's health. Experiences in the OBGYN department. This is the office where a majority of my logs were written at. My chair, her chair. We would sit here and discuss patients before, during, and after the appointments. Obstetrics focuses on the care and treatment of women before, during, and after pregnancy. There are 4 main tools that we used whenever we would deal with OB patients. The first one would be the pregnancy calendar date wheel. This date wheel determines an approximate date of that day where the baby's at. We have the measuring tape, and we would measure from the pelvic bone, which is down here, all the way up to the fetal crown, which is up here. And then we have the Doppler. The Doppler is used to listen and to measure the fetal heart tones of the baby. And lastly, we have the lubricating jelly, which would create a smooth surface when we use the Doppler. Some of the patients I saw would complain of nausea and vomiting. I saw a lot of patients that were in their 35 weeks of pregnancy, and that's when they are required to get the Group B strep infection test, and it's a bacterial infection. And the non-stress test, which is this picture, and it measures and records contractions and the heart tones of the baby. We have prenatal vitamins, and my mentor liked to express that folic acid should be in those prenatal vitamins, and that you should start taking prenatal vitamins when you're planning on having a baby, because it takes away from the child getting any birth defects such as folic acid deficiency. Then we have postpartum depression. Unfortunately, I experienced a patient who did have the postpartum depression, and it's called the baby blues. This woman was not at all happy. You could see in her eyes that she didn't see the joy of bearing a child. And also I remember her especially because she had a really bad case of stretch marks. Really bad. And then I also experienced a woman whose water broke, and she was rushed into labor and delivery. And lastly, under my mentor's supervision, I was able to use the Doppler on a patient and listen to the heart tones of the baby. She said I did good. Okay, and then the types of patients I did see, unfortunately, was a teen mother suffering from domestic violence. I also saw a homeless and druggy parents, and the homeless lady that I saw actually was on her 6th child, and she had no custody over 5 children that she has with previous partners. And then we have a patient with herpes that is pregnant that I saw. Gynecology is concerned with the treatment of diseases and disorders of the female reproductive system. These are some of the contraceptives that I saw while mentoring. The first one is the Depo-Provera, and that shot is given every 3 months. We have the Bayaz, which are pills taken every day. We have the NuvaRing, and I can quickly show you how it works. This is the NuvaRing, and it gets placed into the vaginal canal. You have to make sure it gets all the way in, and every 3 weeks you just pull the string and take it out. And then I actually saw an IUD placed in a woman, and she looked like she was in pain when they were measuring and actually placing the IUD into this woman. And this is an actual picture of the IUD placed in, and you see the string that you can take out, and it prevents pregnancy for 10 years. Pap smear is a screening test that detects signs of cervical cancer and cervical abnormalities. Unfortunately, I saw trichomoniasis, which is an STD. I saw it under the scope, and it looked just like this. This is an epithelial cell with the flagellum coming out. That's how you determine it is trick. Cytocele. I saw this lady's bladder, and it was kind of like protruding out. And that's what a cystocele is. And then I saw other STDs such as chlamydia and gonorrhea, urinary tract infection, and the well woman exam, which I'll discuss later. Whenever a patient complains of vaginal irritation, there are two main causes: bacterial vaginosis, BV, and yeast infection. You can tell when it is bacterial vaginosis because you have to do a whiff test. You smell the swab, and there's a really distinct odor to it, whereas to the yeast infection, there is no odor at all. Future in this career? Yes. During my mentorship, I did develop a passion for this career, and I want to be able to, I always knew I wanted to be in the health field, but I want to be able to care and treat patients. There is financial stability in this job, in the healthcare field, I think. And then also, I want to have a set 9-to-5 job schedule, and whereas the doctors, they're always on call. There's practitioners, they get to wear a free dress and a coat, and also they have free health insurance. That's always a good thing. Okay, so now on to the well woman's exam. Amanda's going to be helping me out with this. So, Amanda, I'm going to be looking through your chart first and looking at your history of any allergies or any medications. And I'm also going to look into your social history over here to see if you are smoking or drinking. I'm going to try to encourage you not to if you are. It looks here that you are not. Good job. Okay, so now I'm going to ask you several questions. Are your periods irregular?
No.
No, they're not? Okay. Do you currently have your period?
Yes.
I ask that because if you come in to get a pap smear and you do have your period, the cells in your cervix do get obstructed with the blood. Are you sexually active?
Yes.
How many partners have you had in the past year?
5.
5 partners? Okay. And have you used condoms all the time?
Not consistently.
Okay. Are you on birth control?
Yes.
What kind?
Depo.
The shock?
Mhm.
How do you liking that?
It's caused me to gain a little bit of weight, but it's alright.
But you're liking it, right?
Yeah.
Okay. So now I'm going to go on to the actual physical exam. The first thing is the breast exam. So can I have Amanda please place her hands behind her head? I'm going to do circular motions around her breast, and I'm going to check bilaterally for any swellings, pains, or any deformities. Because you want to check both sides so that you see that if there are any differences from each breast. Now, using my lubricant jelly, I am going to do the pelvic exam. Oops, wrong hand. I'm going to place my fingers into the vaginal canal and feel inside for any displacements. Okay. Now onto the actual pap smear, Amanda. This is going to be a little uncomfortable considering this is your first time, but it is quick. So using the speculum, I'm going to place it into the vagina to widen it, and so I have a better view of the cervix. And that is the cervical os that you see. This is where the baby comes out, if you don't know. I'm sure you all do. Okay. So I am going to place my spatula, because these are proven to get the best results in pap smears, and put it in to get some endocervical cells from the cervical os right there. Place it into my solution. And since, Amanda, you've had 5 partners in the past year, I do have to check if you have any gonorrhea or chlamydia. Are you okay with that?
Is it gonna hurt?
No. We already finished the first part. Get some more endocervical cells from the cervical os. Place into the solution. This will be sent to the lab for testing. Now the hard part is over. We will be calling you the next week to tell you if you have had any abnormalities in your results.
Okay. Thank you.
Thank you.
Yay, Crystal.